Welcome back to this channel, ladies and gentlemen. So in today's episode, for those who are returning subscribers, thank you very much for keeping on supporting us. Once you have just bumped into this video, kindly consider subscribing, like, share, comment, and let me know what your thoughts are about this particular video down below. So in today's episode, we are going to talk about a very sensitive topic. However, it is very important that each and every one of us gets to understand what happens and what are some of the causes of this particular topic that we want to talk about. So today I'm going to talk about our ladies and their private part, or rather 1% of the human body, or the vagina. It is important that this topic be discussed because this part of the human body, however much it consumes only 1% of the total body surface area, it forms key parts of the human body or the organs, and which eventually form the organ systems. So the vagina, or rather the female genitalia, is very, very important for obvious reasons. One, it is the primary site where reproduction takes place, pleasure, and all other things. That it also forms the bulk of female confidence and everything that defines a woman. So any attack on it or any disease on it, however much it is one of the smallest surface areas within the human body, could actually present a wide range of discomfort and uncertainties and lowest levels of self-esteem for a woman. So today we're going to talk about some of the causes of vaginal discharge that we really need to understand about. It is a matter that is concerning because in the recent past and even recently, majority of the cases that bring our ladies to the hospital are actually vaginal discharge. Some of them, for this case, normally have had this particular condition for a long period of time even before coming to the hospital. Most of them that we normally see normally have had this vaginal discharge even for a week, month, days, or even 2 to 3 months. Now, the main challenge is that whenever they experience this particular condition, most of them go to the pharmacies. However, the pharmacies that we have around in Kenya, most people who attend to people there are not actually qualified medical professionals. Someone is just somebody who has read about medicines and he knows when you have stomach upset, you should take this one. When this happens to you, you should take that one. But now, if you have a more complicated condition that requires actually medical reasoning with a medical background, they could not be in a position to assist you more. So whenever you go to the pharmacy with a condition of a vaginal discharge, they will give you something that is so obvious even without knowing the primary cause of that particular discharge. So this is a topic that it is important that we understand it, because treating it also becomes complicated if you are not able to identify the cause of that particular discharge, because it could come from an array of issues. So straight into it. So vaginal discharge is actually a collection or a group of diseases that we normally call vaginitis. And vaginitis is just a collective term to refer to as vaginal discharge, itchiness, or even inflammation within the vagina or the vulvas. So the first major cause of vaginal discharge is normally what we call vulvovaginal candidiasis. So just as the name suggests, it is fungal infection of the vagina and the vulva. The vulva are normally the outer swellings that we normally see whenever you look at the genitalia, the swellings that normally cover the 1% of the female reproductive system. So this particular infection is a fungal infection that affects inside of the vagina and outside of the vagina, which is the vulva. And its characteristic discharge is normally a whitish discharge that normally resembles curdled milk, or in Kenya, what we call maziwa mala. So it is important that you know this, because this one is a fungal infection and therefore antibiotics do not play a role in treating it. You could do a test in order to have this condition diagnosed. That is, your urine could be tested or a swab could be taken to the lab for a test called gram staining and wet prep, so that you could be able to see whether there are budding within that particular swab that has been taken, or even in the urine sample which has been taken. It is important that you be able to see in the microscopy whether there are yeast cells which are going to be seen. However, there is no really main intention for lab tests because its symptoms are actually straightforward, because the discharge is whitish, resembling curdled milk, and in most cases there is no foul smell. It is also accompanied by other symptoms like itchiness or painful urination. And this painful urination could come as a result of, once you feel the itchiness frequently, you will find yourself scratching your genitals. Once you scratch your genitals, you may develop small bruises that are microscopic, not visible to the physical eye. And automatically, your urine is acidic in nature. So when you urinate and it splashes over those bruises that has formed as a result of you scratching or as a result of the fungal activity, you will definitely feel some pain. So the key catch point is that this condition is mainly treated by antifungals, not antibiotics. The second most common cause of vaginal discharge is what we call bacterial vaginosis. Bacterial vaginosis is a vaginal infection that is caused by a bacteria. And its key symptom is that you will have a discharge. Some people may have a clear discharge or grayish discharge. And for this particular case, its characteristic symptom is it has a foul smell, mostly resembling fish, fresh fish from the lake. Ni kama ile samaki mbichi ambayo imekaa for some time ikaform harufu fulani. That is Swahili in Kenya. So this particular condition is caused by a bacteria, and it's mainly hygiene related, and things like vaginal dodging, using of perfume detergents, or lack of adequate or inadequate hygiene of underpants and putting on underpants that could predispose you to this particular condition are one of the primary risk factors for this condition. So it is important that those underpants that you put on are normally cotton based, and wash them only with soap and water and air them outside for sun drying. It is also important that you understand that you should avoid dodging, and vagina should only be washed as at when you're taking your shower, and you should not use soap to actually vigorously scratch and pour water inside the vagina for the purposes of hygiene. The vagina has got its own mechanism of cleansing itself, and therefore your role is only to clear the outer part where the actual eye can see, not separating the labia and pouring water inside the vagina to ensure its cleanliness. The best antibiotic for treating this particular condition is metronidazole. However, nowadays these bacteria have actually developed resistance to most of these medications, and it is important that we do a combination of medications. However, this one can only be done as a matter of consultation and further discussion with your healthcare professional. The third common one is what we call trichomoniasis, caused by a bacteria that is called Trichomonas vaginalis. So however much this one is a cause of vaginal discharge, it is important that we note that it is sexually transmitted. So whenever it is that we will diagnose you with this particular condition, your sexual partner must also be treated. The discharge could at times be grayish. Some people normally, as other articles have said, that it could be greenish. However, it is a frothy discharge, and it could be profuse. It just comes out. You realize that when you put on your underpant, you realize from nowhere your underpant is wet. And the characteristic is that there is no foul smell in this particular kind of a condition. So the mainstay of treatment in this case is normally secnidazole. However, just as I have put it across, some of these bacteria has developed resistance to majority of these medications. So it is, however, important that you get to be tested. Once a diagnosis is made, a proper combination of medication should be given to you so that you ensure that you get cured and healed. Other classes of sexually transmitted infections such as gonorrhea could also cause vaginal discharge. And gonorrhea is typically sexually transmitted, and gonorrhea can affect any part of the body where there are squamous cells. Not basically maybe the types of cell, but the gonorrhea can affect the vagina. It could affect the eyes. It could affect the throat, depending on which kind of sexual intercourse you engage in. If you have fetishes and maybe you have oral sex, you shall get gonorrhea of the throat. I've also heard there are some fetishes where now the guy does his thing, and once he is about to reach the end of the journey, they reach the end of the journey on the female's face. So if that one is done to your face and the guy has gonorrhea, you will have gonorrhea in your eyes. And that particular one is normally challenging to treat. However, we normally try our level best to treat it. So the discharge in gonorrhea, the vaginal discharge, is going to be mucopurulent. So purulent to mean pus and muco to mean mucus. So it is a discharge that is like pus and has mucus. So that is the typical type of discharge that you shall expect in gonorrhea. However, for this particular condition, since it is a disease that has been there for ages and ages, its treatment has been challenging because the bacteria has been gaining resistance to a wide array of antibiotics that is used to treat it. So that is why it is important that initially the best antibiotic of choice is normally ceftriaxone injection, and it is given through the muscle for this particular case. However, it is important that you discuss with your healthcare professional so that you see the best option that fits you. It is important that we talk about these particular conditions because if left untreated, something like gonorrhea, you could have ascending gonorrhea. It could even attack your uterus or the fallopian tube and render you infertile, or even complicate your life more by making you have other conditions such as ectopic pregnancy. So it is important that whenever you see any discharge within the genitals of the vagina, it is important that you get it checked, because some of these conditions, if not treated, could complicate and even form other things like pelvic inflammatory diseases that could predispose you to those things I've talked about, infections of the uterus and even the fallopian tube, making you maybe infertile or have risk of things like ectopic pregnancies, which could be life-threatening. One thing that you have noticed with all those things, all those conditions that I've talked about, is that I know the symptoms even without having them tested. It therefore means that if you have any of those and then you call me and text me and maybe inquire from me about them, I will be able to make a diagnosis and come up with prompt management even without you going to the hospital. Once I prescribe these medications, you may buy them over the counter in the pharmacies that maybe we have around, or if it is a case that requires injections, I could prescribe the injection and you choose a hospital of your choice, because nowadays there are a wide variety to choose from. That is why I welcome you to my new telemedicine forum, where at a fee of 500 Kenya shillings, you get to interact with me one-on-one, explain to me your symptoms, I do a diagnosis, and from that I be able to prescribe for you the medication that is going to help you. With the number of years I have of experience in this field, I am certain that I could be able to make prompt diagnosis and assist you much better, even without the hassle of having to travel to the hospital, having to make a line that is time consuming, given also the nature of our works nowadays. We get so busy. So how about a click away from your phone? Just make a call to me, and at a fee, I be able to assist you better and prompt and fast. It is, however, important that you note that this one is actually allowed and legal, because by the time you get to the hospital and you get seen by a healthcare professional and sent to the lab, the point where you explain your symptoms and you get examined, by the time you go to the lab, we normally have 90% of diagnosis. So the lab test normally confirms the remaining 10%, so that we'll be able to confirm the diagnosis that we already knew about. So that is why I'm telling you this one is possible, and therefore you are most welcomed to my telemedicine forum. So until next time, this is Kowegi Doc. Kindly subscribe, like, share, comment. Thank you.